Hello, I'm Dr. Anna Juricic, your low vision optometrist and the creator of the Vision Enhancing Method. Today, I'm excited to talk to you about a new technology. Um, New more for North America. I'll let you know it's a technology or an area of science that has really been well adopted in Europe for now almost 2 decades, if not longer. And so, what I want to talk to you about is actually low level light therapy, or what's also known as red light therapy, or what's also known as photomodulation therapy. All three are synonymous, which means they're all basically referring to the same thing. And so, what the Aruna light is, it's actually a brand new device that has only been launched in North America in September of 2023. So this is, cutting edge technology. And it's actually a group of colleagues of mine, some Canadian eye doctors, who've teamed up with a group from Europe who've actually helped create the Aruna light. So the Aruna light comes in this box like this here. And this case is inside the box, and it comes with these specialized glasses I'm about to talk to you about. There's a recharging cable and a booklet. So what this technology is all about is that it's been shown with science, with a lot of studies, that low-level light therapy or red light therapy, specifically around the wavelength of about 670 nanometers, has shown to have benefit to retinal cells. So the retinal cells are actually at the back of the eye. The eye is made up of the retina, and many patients who have macular degeneration, there's damage at the back of the eye, an area called the macula. So the red light therapy is addressing at a cellular level where it can actually kick activate what's called the mitochondria. And the mitochondria is actually the powerhouse center of every single cell in our body. And I talk about the mitochondria a lot. I have 4 kids, and they're doing it in science class. So some of you might remember hearing about the mitochondria all those years ago when you were taking science in grade school and high school. And so the mitochondria, as I said, it's a powerhouse center of every cell. And if the mitochondria is not working well, it means that the cells are not working well. And we see that as we all age, the mitochondria often isn't working as optimally. What red light therapy has been shown to do is kick activate those viable cells. Those are the cells that still want to work but might not be working optimally. And what it does, it actually creates that mitochondria to have the energy center, the pathway, work more optimally, so that the way it helps improve cellular function. And how it actually has an impact on cells is it helps decrease inflammation and actually help with circulation. So many eye conditions that I see in my examinations when I see my low vision patients are related to not having enough oxygen getting to the cells of the eye, and there's damage that happens as a result of it. So macular degeneration has an oxidative stress component. Glaucoma has an oxidative stress component. Anybody who has optic nerve damage, there's oxygen stress or deprivation. Same thing with anybody who's had a stroke in the eye or the brain. There's oxygen deprivation that happens. So all of these conditions, we want to be creating ways to actually bring in more oxygen to that cellular level. So there was a team of doctors, those colleagues that I know here in Canada who've teamed up with the group from Europe, wanted to come up with a way that there could be a home therapy kit where there could be home therapy glasses that a patient could just put on 3 minutes every other day to help kick activate those retinal cells and eye cells. some of these colleagues would have patients come into their clinic to actually have the red light therapy done in their clinics on the instruments that would be thousands and thousands of dollars, and they'd have to come every 3 weeks for about 10 to 15 minutes for a treatment, which isn't practical for many people, having to come in so regularly for a treatment that doesn't take so long. So they've been able to come up with the Aruna light. So this is a very lightweight pair of glasses. And inside, there is actually 26 diodes of red light. I'm going to turn the button on the side, on the right side. And if I press it down, you're going to see that now those lights light up at the back. And how you use this device with your eyes closed. Now, if you accidentally open up your eyes quickly, it's not going to cause damage, but it's recommended eyes closed. You put this on for 3 minutes. Every other day is a recommendation right now. And so what I tell patients to do is they put it on for 3 minutes. During those 3 minutes, I want you to just relax and think about your breathing. Because remember, when you have oxidative stress, it means you don't necessarily have the proper amount of oxygen getting to all parts of the eyes, the brain, other parts of the body. And breathing is one of the pillars that I talk about in the Vision Enhancing Solutions Kit. So you don't have to worry that you don't know if it's been 3 minutes. The device will automatically turn off after 3 minutes. When you have this on, I always tell my patients who've purchased it, don't worry what color you might be seeing when this is on. Whatever color is actually just right for your eyes. After you take it off for the 3 minutes, I tell patients, keep your eyes closed for another 2-3 minutes, and you might see a little bit of a change in colors. Don't worry what color it is for you if you have a family member who puts it on and describes a different color. Whatever color you see is right for you. But what you're going to be seeing with your eyes closed when you remove it is actually your retinal cells are getting rejuvenated. And so it's recommended that you put this on in the morning or after your first meal of the day. And that's because those cells, the mitochondria, just got a power boost of energy from eating food. And they recommend that you have some kind of liquid. It could be a glass of water, it could be tea, coffee, milk, whatever you drink in the morning, because your cells also need water content to be working optimally. And they have found that this is actually the best way to get that full effect of using the Aruna light. So if you want more information, just go onto the website and you can see more information. And I'll even have links where you can actually look up some of the research studies that have shown that exposure to 670 nanometers of light, which is different than some of the other red light or low-level light therapy devices and mats that are out there that have benefits for overall health. Those have a wider spectrum. These have been specifically designed for people who have eye conditions that they want to actually decrease inflammation, improve circulation, and help with improved vision to at least optimize at a cellular level those retinal cells. Remember, there's no device out there that will actually cure or treat the areas that are permanently damaged. This is working on those cells that haven't been permanently damaged and need to be activated to work more optimally. I hope you found this insightful. Until next time, be well and thank you.